We're here in the free speech area at Tech between the Student Union Building and the library, asking students their take on the Affordable Care Act and the potential to repeal it.
The Affordable Care Act, I think it's a good progressive agenda to provide constructive social policy.
So I have, as best as I can, refrained from developing a strong opinion on the Affordable Care Act because I don't understand a lot of the relevant details, a lot of the issues with its implementation.
I think that it's a great program. Like I said, I'm from Connecticut, and so I have Connecticut insurance, and so it's really hard for me to get healthcare down here because a lot of the places don't cover, my insurance isn't covered there. And so I think it's just a really good way for people who need health insurance everywhere to get it when they need it.
I know that it affects a lot of people. I work in a pharmacy, and it affects a lot of people in terms of how they can actually get their medications and stuff like that.
I am sympathetic, though, to the idea of in a first world country. I am sympathetic to the idea of universal health care or health care as a human right.
For the United States, and especially the lower class, and wasn't quite properly implemented economically with the capitalist market that we have, highly competitive. It's sort of driven this divide between whether insurance and healthcare should be really provided as a public service or be promoted as something that's done for corporate gain. And so kind of mediating that divide, the Obamacare didn't do a good job of that, and so it does need to be remedied.
Spencer brings us to our next question. We asked these same students their feelings on a possible repeal and its effects. Here's what we heard.
I think that it'll be really negative for a lot of people because a lot of people really turn to their health insurance to pay for a lot of stuff because if they don't have that, they have to pay out of pocket, and a lot of people can't afford that, so they'll just end up going, or they won't end up going anywhere, and they could actually need help. They could be sick and they won't go get it because they can't afford it. And I think it's really important for them to have something that'll help take that financial burden off of them.
If there's an implementation of policy prepared before that repeal, and I think so, I wouldn't mind it being completely repealed, but there's components of it that I think were good.
One of these good components students touched on was being able to stay on their parents' insurance until age 26, and Garen said if that changed...
Honestly, I'd probably just go without health care until I got a stable job, because I'm not really in a position right now where I can get a job, so I'd probably just go without health care.
Spencer's response was similar.
At my age right now, if it was completely repealed, then I'd have to either have a job that covers it or pay for it by myself out of pocket. I wouldn't like that. I like being covered by my parents until I have that foundation, a job, and insurance. Because of how our economy is developing, people are graduating later, they're getting their life started later, buying homes later, and so having that support for a little bit longer I think is really beneficial.